Welcome to the Breast Cancer Task Force educational series. This recording is focused on risk assessment, risk reduction, genetics, and screening. The mission of the Breast Cancer Task Force, a part of the Colorado Cancer Coalition, is to reduce the impact of breast cancer for Coloradans through risk reduction, early detection, access to personalized cancer care, and comprehensive survivorship support, regardless of social determinants of health, geography, or personal community identity. The task force is a statewide group of professionals, organizations, and community members working together to support breast cancer related efforts across Colorado. The task force provides a space to share resources, collaborate on projects, and highlight current work in the field.
Hello, my name is Julia Schiller, and I'm a genetic counselor at Advent Health Parker. Today, I'll be discussing the genetics of breast cancer along with hereditary cancer risk. We'll be talking a little bit about what hereditary cancer is, indications for genetic testing, the past and the present of genetic testing, as well as how to access genetic testing and the role of genetic counselors. We'll start with what hereditary cancer really is. This graph is a breakdown of the causes of cancer. With hereditary cancer genetic testing, we're trying to figure out why that cancer happened, essentially whether or not genetics is to blame. Most cancers are not genetic. Most cancers are sporadic, happening for non-genetic reasons like age, environment, lifestyle. But when we see something out of the ordinary, say a rare type of cancer, a young age at diagnosis, or a type of cancer trending in the family, we start to wonder if there's an increased baseline risk coming from a genetic mutation. Hereditary cancer risk is when someone has a genetic mutation, also known as a pathogenic variant, in a tumor suppressor gene or a proto-oncogene. These genes are supposed to provide the body with instructions for not getting cancer, so having a genetic mutation confers increased risk. Knowing about hereditary cancer risk can help patients be proactive by completing additional cancer screenings, and for patients with an active cancer diagnosis, finding a genetic mutation can help to personalize treatment plans. The familial part of this graph is about having a family history but no findings on genetic testing, and is a good way to emphasize that we are not finished discovering new gene-disease associations. Families also share more than just their genetics, so there may be a shared environmental risk factor explaining a pattern of cancers in the family. We can't talk about hereditary cancer without a basic genetics overview. The way I explain this to patients is that genes are our body's instructions, and cancer genes are our body's instructions on how to not get cancer. Essentially, they protect us from getting cancer. You get one copy of each gene from each parent. So if someone is born with two functioning cancer protectors, then they have a working copy if one ever stops working, a backup. But in this scenario in the middle, one of those genes had a spelling error in it that we call a genetic mutation, probably passed along from a parent, but sometimes happening spontaneously at conception. In this scenario, somebody does not have a backup copy in this pair of protectors. So wherever it's supposed to be functioning is extra vulnerable to cancer. If somebody starts off with only one working protector and no backup, that is hereditary cancer risk. They're not guaranteed to get cancer, but knowing about this elevated risk can help us tailor their medical management to their individualized genetic makeup. When we're thinking about hereditary cancer, we're thinking beyond the BRCA genes. Oftentimes, my patients will come in asking for the BRCA test, and really the answer there is yes and. Mutations in the BRCA1 and BRCA2 genes make up about 50% of hereditary breast cancer risk, or about 5% of all breast cancers. There are many other genes associated with hereditary breast cancer. Take the gene PALB2, for example. Current estimates show someone with a PALB2 mutation has between a 32 and 53% lifetime risk for breast cancer, and those people would be recommended to discuss the option of a prophylactic bilateral mastectomy. So, hereditary breast cancer genetic testing nowadays should look beyond the BRCA genes. which is why a large panel is the standard of care for hereditary cancer testing. In the same vein, it's important to ask questions about a family history of any cancer types, since many genes associated with breast cancer are also associated with other cancers. If a patient completed hereditary cancer genetic testing for only the BRCA1 and BRCA2 genes, it might be time for them to update their genetic testing, because we were not regularly testing for a lot of these genes until around 2010. That's about the time when insurance started covering genetic testing panels, including genes other than BRCA1 and BRCA2 as well. Genetic testing prior to 2010 was pretty different than it is now. There was often poor insurance coverage, necessitating testing for only a few genes, even if the patient had a cancer diagnosis, and even then testing could be very expensive. Genetic testing analysis was not as comprehensive either. It used to look at only certain parts of the gene that were mutation hotspots, and did not always look for deletions and duplications along with sequence changes. We didn't know as much about cancer genetics, so there were also less management changes and treatment options available based on the results. Nowadays, there's better insurance coverage, with many insurance companies referencing NCCN guidelines for determining coverage and eligibility. Multi-gene panels are the standard of care, since we now know of many genes associated with hereditary breast and other cancers that would qualify a patient for increased medical management or early cancer screening. There are also more tailored cancer treatment options from pharmaceutical companies such as PARP inhibitors. With expanded knowledge, research, and insurance coverage, comprehensive testing just makes sense. So, how does anyone stay on top of this ever-changing landscape of hereditary cancer and genetic testing? We rely heavily on NCCN guidelines and other published literature, such as gene reviews, to help us stay current on what the recommendations would be for who qualifies for genetic testing, what should be on the test, and where do we go from there. The NCCN guidelines can be found on their website by navigating to Guidelines, Detection, Prevention, and Risk Reduction, and clicking on which genetic guideline you're interested in viewing. The first guideline, Genetic Familial High Risk Assessment for breast, ovarian, pancreatic, and prostate cancer, is where you can find the breast cancer guidelines. The screenshot on the bottom left includes part of the list of clinical indications for hereditary breast cancer testing. Meeting NCCN qualifying criteria could mean that the genetic counseling and also genetic testing might be covered by insurance per provisions in the Affordable Care Act. General characteristics of hereditary cancer include young ages of diagnosis, particularly 50 or younger, multiple family members on the same side of the family with the same kind of cancer, uncommon cancers like triple-negative breast cancer, pancreatic or ovarian cancer, and bilateral or multifocal cancers. So these are what to look out for if a patient is talking to you about their family history. A lot of patients ask me about the benefits of genetic testing, and that is individualized, but generally I think that for a lot of families there has always been a big question about why that cancer diagnosis happened, and even for the person who got the diagnosis, the question is often, why me? Knowing whether or not there is a hereditary cancer risk in the family can help family members keep ahead of things and be on the proactive side. This can also help aid in treatment decisions, particularly in breast cancer. Having a genetic risk factor or hereditary cancer risk can impact both surgical and therapeutic treatment options. Genetic status can also provide information for future cancer screenings for the patient or their family. For example, a breast cancer patient with a BRCA1 mutation might consider a prophylactic bilateral salpingo-oophorectomy at the time of their mastectomy. Testing can also provide useful information for family members. I meet many patients who want to do testing to see what information they can gather for their siblings or their children's sake. Some insurance companies require a genetic counseling visit prior to genetic testing for coverage purposes, particularly if the patient wanting testing has not had cancer. If you're interested in referring your patient to a genetic counselor, but you're unsure if there are genetic counselors in your area, the website findageneticcounselor.nsgc.org will list genetic counselors in your area available for contact. High-quality, clinical-grade genetic testing can be ordered by a genetic counselor or other healthcare provider who feels comfortable doing so. Different clinical genetic testing labs have different test offerings, billing practices, family variant testing programs, self-pay pricing, and turnaround times. So picking the genetic testing lab, not just the genetic test, is also important. Notably, 23andMe health testing, which can be accessed without a healthcare provider, is not clinical grade testing and is not comprehensive in the same way that ordering testing through clinical hereditary cancer labs would be. If a patient has a BRCA mutation found on 23andMe testing, they would need to complete clinical testing as confirmation before medical management changes would be warranted. Additionally, a patient has not had comprehensive BRCA or hereditary cancer testing if they completed 23andMe's health screening, so negative results also necessitate clinical testing. Other reasons that you might opt for your patient to see a genetic counselor are that a genetic counseling visit is very comprehensive. The screenshot on the left is a list from NCCN of what should be included in a pre-test genetic counseling visit. Additionally, choosing a genetic testing lab and a hereditary cancer panel is something genetic counselors are specifically trained in, and the genetic testing registry lists 25 different hereditary cancer tests. Certified genetic counselors have completed a master's degree in genetic counseling through an accredited program and have training in both medical genetics and counseling. Our job is to keep current with NCCN and other professional society guidelines, genetic testing, and medical management. Lastly, this testing pairs best with a risk assessment, which is a routine part of a genetic counseling visit. There are multiple breast cancer risk models available for use, but commonly the Gale model is used for a short-term breast cancer risk, and the Tyrer-Cuzick model is used for a lifetime breast cancer risk. The numbers coming from these calculations determine whether the patient qualifies for early or extra screening. Thank you so much for listening to my talk on hereditary cancer risk. If you have any clinical questions for me about my presentation today, please feel free to reach out via email. Otherwise, if you're trying to meet with a genetic counselor or find out where your patient can get genetic counseling, please visit findageneticcounselor.nsgc.org. Thank you.